Welcome to our education and health awareness on migraines. I'm Gayla Lee Chambers, along with Sierra, a senior at the University of Omaha studying psychology. This short informational training session, you will learn more about migraines and how this diagnosis can affect your mental health.
So, what is a migraine? A migraine is a headache that can cause severe throbbing pain or a pulsing sensation, usually on one side of the head. It's often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can last for hours to days, and the pain can be so severe that it interferes with your daily activities. Types of migraine headaches include migraine without aura, a common migraine, which most people with migraines have. This type of migraine causes a throbbing pain on one side of the head. The pain is moderate to severe and gets worse with normal physical activity. You also may have nausea and vomiting and may feel worse around the light and sound. The headache lasts 4 to 72 hours if it's not treated. A common migraine doesn't begin with an aura. Migraine with an aura, or a classic migraine. Some people with migraines get an aura up to 30 minutes before they have a migraine. Symptoms of the aura include seeing wavy lines, flashing lights, or objects that look distorted. Other symptoms include tingling or a pins and needles feeling. Other types of migraine headaches include menstrual migraine, which many women have migraines around their menstrual cycle. These occur a few days before, during, or right after their period. The symptoms are the same as those of common or classic migraines. Migraine equivalent. Migraine equivalent is a migraine aura that is not followed by a headache. This form of migraine often happens after age 50 if you had migraines with aura when you were younger. The symptoms may include streaks or points of light moving across your field of vision. Complicated migraine. These are migraines that cause symptoms such as numbness and tingling, trouble speaking or understanding speech, or not being able to move an arm or leg. These symptoms go on after the headache goes away. Abdominal migraine. These migraines usually occur in children. The symptoms include vomiting or dizziness without a throbbing headache. The symptoms may occur about once a month. What are the symptoms? Migraines, which affect children and teenagers as well as adults, can progress through 4 stages: prodrome, aura, attack, and postdrome. Not everyone who has migraines goes through all stages. Prodrome. 1 or 2 days before a migraine, you might notice subtle changes that warn of an upcoming migraine, including constipation, mood changes from depression to euphoria, food cravings, neck stiffness, increased urination, fluid retention, or frequent yawning. Aura. For some people, an aura might occur before or during migraines. Auras are reversible symptoms of the nervous system. They're usually visual, but can also include other disturbances. Each symptom usually begins gradually, builds up over several minutes, and can last up to 60 minutes. Examples of migraine auras include visual phenomena, such as seeing various shapes, bright spots or flashes of light, vision loss, pins and needles sensations in an arm or a leg, weakness or numbness in the face or one side of the body, difficulty speaking. Attack. A migraine usually lasts from 4 to 72 hours if untreated. How often migraines occur varies from person to person. Migraines might occur rarely or strike several times a month. During a migraine, you might have pain, usually on one side of your head, but often on both sides. Pain that throbs or pulses. Sensitivity to light, sound, and sometimes smell and touch. Nausea and vomiting. Postdrome. After a migraine attack, you might feel drained, confused, and washed out for up to a day. Some people report feeling elated. Sudden head movement might bring on the pain again briefly. Don't procrastinate. Seek medical advice from your doctor for these reasons. An abrupt, severe headache like a thunderclap. Headache with fever, stiff neck, confusion, seizures, double vision, numbness or weakness in any part of the body, which could be a sign of a stroke. Headache after a head injury, a chronic headache that is worse after coughing, exertion, straining, or sudden movement, a new headache pain after age 50. What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from adulthood and adolescence through adulthood. How do you know if your medical condition is affecting your mental health? Chronic migraines and depression often go hand in hand. In fact, migraine sufferers are, over their lifetime, between 2 and 4 times more likely than people without migraines to develop major depressive disorder. Migraine patients are also at the increased risk of anxiety. Migraines and mental health disorders are also connected by the effects that chronic migraines have on our lifestyle. Migraines affect almost every aspect of our life, from the way you interact with your family to your performance at work. As your social life and progress towards your goals start to slip, your risk of mental health disorders like depression increases. Where should you go for an assessment and/or evaluation? You can see your primary care physician, a licensed counselor, community health clinics, or your local hospital.
Our tip for the day: migraines are the worst form of headaches. If it persists, then seek professional medical advice. This concludes our education on awareness topics on migraine. I'm Gayla Chambers along with Sierra, and we hope this was helpful and that you have a nice day.